My name is Robbie. I'm here to present my project Hot on Health, which is all about embracing technology and social media to promote primary healthcare. I know as nurses and healthcare workers, we sort of hear the word social media and then we tend to get a bit sort of clamped up and closed off, and so I just want to sort of talk about how it can be a positive thing and can be a very important tool for health promotion. So just a quick question, personally, who here uses social media? Facebook, Instagram, Twitter, everything. Okay, perfect. So who here uses social media for work? Yeah, okay. So it's probably maybe about 10% of people who use it for work, but I'd say almost 100% of us use it in our personal lives. So just a little bit about me. I'm a 26-year-old recent grad. I went to UTS in Sydney. I did a Bachelor of Nursing, Bachelor of International Studies, which was a 5-year full-time program. I work as a general practice nurse in an area of Sydney called Newtown, which is, if anyone is from Sydney or has been there, it's quite alternative, quite grungy. It's a very, very cool area with a very diverse demographic of patients, which definitely helped me come up with this idea. So what is Hot on Health? So it's quite simple. I'm sort of listening to all these pictures, which are very impressive, very complicated, amazing initiatives, but Hot on Health is very simple. It is a tool for health promotion that is designed to make healthcare information easy to understand, accessible for the general public, and it uses videos, articles, and social media. So basically, I will create very informal videos about a whole variety of healthcare topics, and I will then pair them with a more formal or in-depth article, which you access through a website or social media. And for both of them, I will use all of the references and resources that I have sort of collated together so that you know that it's good, evidence-based information that you're accessing. So the aim is to decrease knowledge gaps around common health issues that we probably see walking through the door all the time, to promote primary healthcare and nurses and preventative healthcare, and also just to get people talking about health more and get them to the GP or to the doctor, because we know that there were some great talks this morning. Health just isn't about avoiding disease. You can access a doctor and access healthcare services even when you're well. It's sort of a process of staying well. Rather than talk more about it, because it is a video platform, I will show you my very first video that I ever created. It's quite a new project. It's only about 9 months old, and it has evolved slightly since here, but it sort of covers all of the key points. Unfortunate freeze frame.
Welcome to Hot on Health. If you're watching this, you're either keen to learn more about health, or you're a friend of a friend that I've bullied into watching this. Either way, thank you. My name's Robbie. I'm a registered nurse working in Sydney, Australia. Unlike most nurses, I don't work in hospitals, I work in general practice. And through my work, I've noticed...
Oh, sorry. God. How embarrassing being a millennial talking about technology and I screwed up my presentation. Now why won't it play? Oh. Nope. Anyone? Technical help? What if I do this?
Welcome to Hot on Health. If you're watching this, you're either keen to learn more about health, or you're a friend of a friend that I've bullied into watching this. Either way, thank you. My name's Robbie. I'm a registered nurse working in Sydney, Australia. Unlike most nurses, I don't work in hospitals, I work in general practice. And through my work, I've noticed some pretty big knowledge gaps when it comes to common health issues. Things like travel health, sexual health, and getting vaccinated. Hearing health information from a doctor in a healthcare setting can be terrifying and not easy to understand. How many times have you left a consult and someone said, "So what were the doctor's instructions?" And you went, "Oh, not sure." Well, I want to change that with this series. I want health information to be easy to understand, accessible, so we never have that feeling leaving the doctors again. I also want to look at why we lack motivation when it comes to health risks that we do understand. Things to do with diet choices, sex, drinking, smoking. Why do we all do these things when we know that it's bad for us? Even though I'm a registered nurse, I don't pretend to be an expert or guru on every topic that I'll discuss. I'll put all the references I use that aren't my own anecdotal evidence into the description box, but I encourage you to read, research, and have conversations with your friends, your family, your partner, your doctor. If we all just start talking about this stuff a bit more, if we open up these conversations, then health won't seem so big and so scary. So remember Nurse Robbie's motto, there is no healthcare without self-care. Bye.
Oh, thanks. Thank you. Thank you. So that just sort of introduces the three main points, which is promoting preventative healthcare and increasing health promotion, promoting primary healthcare and nursing as a profession, and then engaging people via technology. So I work in general practice. Does anyone here work in, probably quite a lot of people in general practice? Yes, so you'll see such a huge variety of things walking through the door. You end up needing quite a large breadth of knowledge, or at least very good research skills. So what these videos actually look like, I've done videos around acne, the flu vaccine, as I'm sure we're all very exhausted by recently, taking a first aid kit, traveling with you, talking about how to access some Medicare services that people wouldn't understand. So what is a mental health care plan? How does that work? Are you eligible? Wound care. What is bulk billing? I'm sure everyone here has been asked, what's a gap payment? What is bulk billing? And doesn't sort of quite get how it works. Talking about our healthcare system, I do quite a lot about sexual health because of especially the area that I work in, but also because there's just so much misinformation about it. I recently went onto the street to do interviews with people in my local area about what they think about healthcare, social media, technology. But the main thing that they all have in common, hopefully, is that they are easy to understand. A lot of health promotion materials that I would come across were fine for me because I did a nursing degree and I found it quite easy to engage with. But I still felt that there was a bit of a divide between what someone in the general public might look at and click on. Whereas these are all meant to be, colourful, vibrant, very sort of basic in the videos and then more formal in the articles. I think Bruce this morning, if everyone was at the keynote, was talking about Go East, so easy, which it should be attractive with sort of the vibrant colours, social media, I can't remember what the T stood for, timely, and they are all quite short. None of them are generally more than 3 minutes, and then if you're interested, you go and you access that more formal mini essay almost online. So it is really important to note as well, of course, because anybody can just create a video and say whatever they want online or on social media. They are all based on evidence and research, which I will find and collate and then give to the public so that they know that it is good information. Okay. So that's basically a summary of what Hot on Health is. Now, why do we need Hot on Health? My three main reasons were to increase rates of health literacy, because the Dr. Google and social media phenomenon is not going anywhere, and also to promote primary healthcare nurses as well. So health literacy. A recent report by the Australian Commission for Safety and Quality in Healthcare found that 60% of Australians have low individual health literacy, which is a pretty staggering number of people. It's obviously a majority of the population of people don't know how to understand health information, process it, apply it to their everyday life. I found that quite hard to believe, and then I started to think about my day-to-day at work. So has anyone here ever had a patient, you ask, oh, so do you take medications? Yeah, I do. What's the name of it? No, I have no idea. Or they do know, and then they go, all right, so what's the dosage? No, couldn't tell you. Or you see someone for a sexual health check and they go, yep, I always get comprehensive STI screens. And then you look and it might only be a urine and blood, but this is a man who has sex with men and needs 2 swabs as well and had no idea that he needed those on his screen. And you sort of start to see that health literacy isn't just about understanding really complicated disease processes. They're everyday problems and how to apply health information to your life. Obviously, in primary healthcare, we know the landscape of health systems and health technology is changing. It makes it a bit more complicated, which is why health literacy rates might not be great. Also, the 6-minute medicine phenomenon. If anyone works in a bulk billing clinic, there's probably a lot of pressure that is put on the GPs to see people and see people fast, and that decreases the amount of quality time that they will get with patients to explain things. You might come across someone in your treatment room for a Hep B vaccine who was not told what Hep B was not told they needed 3 across 6 months because there just wasn't the time allotted in the appointment that they were given. Whereas hopefully a platform like this, if it is innovative or is easy to access, someone might go in and go, oh, I need a Hep B vaccine. I watched that 3-minute video that I saw on Facebook that told me what Hep B was, and I'll go read more about that online or ask some poignant questions. So these are just some pretty startling figures about social media. I think sometimes when I talk to people, they feel like social media is a trend or technology is a trend. And sadly, it's not. the horse has left the stable and healthcare has been left behind when it comes to social media. A very scary statistic is that only the oil refinery business falls behind healthcare when it comes to adopting social media. And every other business and enterprise is sort of better at getting on that and engaging people. So you can see, 1 in 20 Google searches are for health information. 1 in 5 patients will turn to Facebook for health information. 50% of the global population are under 30. And how are these people communicating? Instagram, Facebook, Snapchat, dare I say. I don't have Snapchat. And so we need to sort of learn how to use these, learn how to use them responsibly, because 76% of Australians own a smartphone. This is how we are communicating nowadays. It's not a bad thing. I mean, it's not a bad or a good thing. It's just that we have not been taught how to use it well, and so we can't then teach people how to use it well. But imagine if there was an elective you could do at uni, or there was a grad cert that you could do that was about becoming a social media health advocate. And 10% of grads created a responsible social media channel with evidence-based information and started saturating news feeds with that kind of information. So then people just started to, like Bruce said again this morning, it's the easy choice. It's easy to click on a healthcare social media channel rather than finding out what the latest Kardashian had for breakfast, because there's more of it in your newsfeed. So I also think it's important to touch on this as well, just because of how prevalent technology and social media is. Our jobs are changing as well. It's almost a new job description that's been added on for us, which is teaching people how to use it. Has anyone, put your hands up, has anyone ever had a patient come in and say, oh, I Googled my symptoms, or I looked up my health info online? Yeah, of course. Has anyone ever done that themselves? Yeah, sure. Not me, never, that's terrible. No, of course, so they are doing it, and our jobs are shifting. It's doing everything that we do anyway, but also now we have to learn to engage with it. We have to become competent at it so that then we can teach people, you know what, that's totally fine that you Googled your health information, but here's how to do it better. There was an article or a journal article or study recently that came out that found the reason that the general public couldn't find health info online is because of the way they search for it. So the example was, maybe something like vaginal discharge, and they're not going to type BV or bacterial vaginosis or discharge, but the things that they would look for in forums were literally the quote or the name of the journal article is, "My vagina makes funny noises." And that's how people search for health information. So of course what comes up first isn't, the guideline or the government website, or because I don't remember the honourable minister that we heard this morning talking about that. It's the technical term. So what comes up first is Yahoo Answers, where Joe Bloggs has gone, oh, well that means that you have leprosy and that the only thing you can do is eat 4 raw lemons every morning, and that's what will come up first. But if we know how to use social media better, we can go, oh, okay, well there's the World Health Organization Instagram page you could follow, or there's this government Facebook page, or here are some great words to Google instead. And then the last reason I wanted to create something like Hot on Health was to promote primary healthcare nursing. We know about the framework that APNA is creating, because primary healthcare is often viewed as a step down. It's something you do when you're coming back from injury leave, or it's a lot easier than hospital nursing. And of course, anybody who works in primary healthcare knows that that is not true. I went straight to primary healthcare from uni, and my first 3 months were just this incredibly stressful blur, because I was doing all this huge breadth of clinical skills that I did not feel that I was trained in well, and discovering how difficult and how diverse and how wonderful this job was. So I want to sort of, and by the Hot on Health channel, putting a primary healthcare nurse front and center, people kind of go, oh wow, like nurses talk about that? Nurses know that? Nurses do that? Wow, okay, and they sort of start to shift their thinking, a bit of a cultural shift. In the same way, reduce stigma and stereotypes. Generally, you think about Hollywood examples of doctors, and they're incredibly three-dimensional, wonderful characters who have flaws, but then have great qualities. And then you think about some of the nurses that you see in Hollywood or Australian television. I don't know if anyone watched Grey's Anatomy. So the nurse they featured, Nurse Olivia, was just a complete ditz that gave everybody syphilis. And that was the nursing character. Meanwhile, the surgical interns were mobilizing patients and helping them to the bathroom. Like, it was ludicrous. And then, of course, I think Sanchi this morning talked about in ER, there was the really powerful nurse character who then decided to do medicine. And it was heartbreaking because it sort of took what is a really important job and was like, oh, well, she's valid now because she's chosen to do medicine. She must be smart, even though nurses are smart and they are wonderful and they do make such an important difference. And I think just by having a public figure, having nurse TV almost, where people can tune in and go, wow, they really have something to say, they deserve a seat at the table, they're making innovative choices with social media, let's put them in that report instead of asking them to write the foreword and not including any nurses in it or things like that. So of course, there are things to consider. Yeah, I'm talking too much. I thought I might be. So of course, there's privacy. So none of the information that I put up is about patients. None of it is personalized. It is all completely depersonalized or on my own personal experiences with health and healthcare systems, because that kind of endears people. That makes you feel like you're a friend that they can trust and they listen to you. I don't give health information. None of it is tailored or personalized. I don't let people write in and say, my left foot hurts, and then I start to diagnose them. It's just collating guidelines and evidence that you find online and delivering it to people that way. Of course, there's the risk of negative comments and trolls, but I think if it was a company and I had employees, I'd be more concerned to do a bit more of a structured risk assessment. But it's just me, and I have a fairly thick skin, and I just sort of try to laugh it off. I haven't had too many bad ones. Lots about vaccines, as you can imagine. But otherwise, not too bad. And I featured disclaimers all over the website, social media pages, and the videos, so that people know that, you know, this isn't a consult. This isn't to replace a consult. The idea is to get you into a room to have a consult with somebody. So the impact so far, again, it's quite new, but it's had over 20,000 views across social media so far, all the different videos. I've been able to work with local and international health organisations who've taken interest. So I worked with allied health, a physiotherapist, to create a video about, ironically, the damage that smartphones are doing to our necks. I'm well aware of the irony in that pitch. And then again, that's part of it as well. So I'm not going to pretend that I'm a physiotherapist that can diagnose your neck pain. So you get to see how nurses get to work with other allied health and really become people that almost facilitate care. I'm also working with an international organisation to create videos around prosthetics and 3D printing of prosthetics and amputation. I presented at a festival in Switzerland. I had a few little media recognitions and joined a group called the Global Shapers, which is part of the World Economic Forum. And so what's next? I'd like to do education in schools, and in August I'm going to go into a high school and do a sexual health and responsible social media unit, and I'd like to do a lot more of that for primary schools, just about general health for primary schools and high schools as well. Oh, it changed all the font. I'd like to create, or at least sell maybe some of this content to waiting rooms in general practices, so that instead of the news playing or something else, it's, you know, subtitled video and someone could go, oh my gosh, I didn't know that I could, you know, get antibiotics to treat my acne. If it's a teenager sitting there, maybe I'll ask about that, or, you know, just then it'll prompt people to ask certain questions they might not have thought to ask. And I also want to do a really big social media campaign around sexual health testing. I'm not sure if anyone's seen the work that Prince Harry's done. He does live on-camera HIV testing. So we did the first one in London, and right after that, the rates of HIV testing and sexual health testing completely skyrocketed and exploded. He did one recently with Rihanna in Barbados that had the same effect. So I'm still working on how that would go, but I'd like to do something like that once the profile builds a bit more, i.e. please like the Facebook page. If you do want to have a look at them, that's how you access them. So there's the dedicated website, which is sort of the more formal version, and it's where you access all of the essays as well as all the videos and sort of see some of the latest news going around Hot on Health as well. Then there's a Facebook and there's an Instagram. I do have a Twitter. I didn't put it up because Twitter just terrifies me, even though I know it's so important in the sphere of public health. I want to get better at it before I jump into hashtags. And that's it. Those are my references, so you know I'm not just sort of talking out of my ears here. And thank you. Does anyone have any questions?